Well, let's take this on. Let's speak to Dr. Rijo M, who's a public health expert and consultant to the World Health Organization. Joins us from Kochi in the Indian state of Kerala. Dr. John, welcome to the program. 100,000 deaths. It's the third highest death toll, 6.5 million cases nearly. And I think it's right to say, isn't it, that it could be a lot more. How reliable do you think those figures are?
Well, thank you for having me in the show. As you rightly said, we have reported more than 100,000 cases, but there are a lot of reports out there which suggest that there may be quite a bit of underreporting going on. So we can't really rule out that. But then we really can't. Nobody is disputing the fact that there is underreporting, but there's always doubt on what is the extent of underreporting actually happening.
Right. It does have the highest number of recovered patients, though. So what do we read into that?
A lot of recoveries in India. It is quite clear that the kind of infection that is happening in India is not quite severe because of our demographic dividend in India. We have a very large young population in the country, so the number of people who are infected quite severely is very limited, unlike in many other countries. And that is also one of the reasons why we have a relatively lower mortality rate in India compared to many other states, because we have a relatively young population with a low median age compared to many other countries. This is a clear reason why the number of deaths itself is quite low compared to most other countries out there.
Yeah, interesting. This was always going to be a huge challenge in India, always likely to happen, I guess, with the population of 1.3 billion. What do you think the government should have done and should do now to stop this getting any worse?
Well, I think one of the things that the government should have done right from the beginning is to really ramp up the testing of the people, but the testing has been lagging quite a bit right from the beginning, and it is clear from many surveys that has happened. Recently, one of the surveys by the country's top medical body, ICMR, which did a seroprevalence study across the country, it suggested that the actual number of cases would be around 20 times higher than the reported number of cases, which clearly means there are a lot of cases out there which are undetected, and that